Hello, beautiful people. You're welcome to Nurse Ika Show, and of course, I am your favorite host, Nurse Ika. Today on Nurse Ika Show, we are going to be talking about something that has to do with everybody. Do you have a breast, or do you have someone who has breast? Yes, of course, we will all agree that each and every one of us have a breast. Now, today, why do we want to talk about our breast health? Why is it important for us to actually have a closer look into our breast health? Remember that when you a self-awareness about your breast help you to maintain healthy breasts and also to quickly identify any health issues that pertains to your breast early enough. Now, okay, today we are going to be looking at breast cancer, and in this video I'm going to show you how to do a self breast examination at home. What exactly is breast cancer? Breast cancer is actually abnormal growth of cells in the breast tissue. I want you to understand that breast cancer affects majority of people, and it is the second leading cause of death in women. Now, breast cancer can affect both men and women. However, it is more common or more prevalent in women. What are some of the risk factors? We have heard of breast cancer here and there. Particularly, I have been touched in one way or the other due to this illness called breast cancer disease. My friend has been so overwhelmed, so depressed because she lost a close one. Imagine if you were in her shoes and you have to lose somebody so close to you because of something that probably, if you had an idea on how to prevent it or how to quickly diagnose and manage it, that person's life could have been prolonged or they could have been saved. Now, many of us have been hearing of this breast cancer. I know we have questions. Your first question may be, can it be cured? Calm down. Yes, the good news is yes, breast cancer can actually be treated and you can be cured from it. However, it depends on how early enough the the diagnosis was made such that treatment can be given at the appropriate time. So before we move further, I'd like us to look at the risk factors. What are some of these risk factors for someone to develop breast cancer? Ideally, we have the modifiable and the non-modifiable risk factors. Modifiable risk factors are simply things that are things that you can do to reduce your chances of getting this particular disease called breast cancer disease. Now, for the non-modifiable risk factors, these are things that are beyond your control. There's nothing, absolutely nothing you can do about it. I want you to understand or to note that because they say you have these risk factors does not necessarily mean that you will end up with the disease. And because you do not find yourself having any of these risk factors, does not exclude you from actually having the disease. So now, what are some of these risk factors? We have age. Studies have shown that as you age, your chances of developing breast cancer, especially in women, increases. Also, we have also seen that people who have early menstruation, they start menstruating at a very tender age, which means that the level of estrogens in their system is higher. They have a higher risk of developing this breast cancer disease. Another factor is late menopause. For women who take a longer time to get into menopause, or those who take some pills to counter menopause, also have a higher risk of developing breast cancer. Then, studies have also found a relationship between obesity and breast cancer disease, which means that people who are obese, whose weights are out of the norm, also have an increased rate of having this breast cancer disease. We will not say all of this and forget that alcoholism equally has a role in someone developing this breast cancer disease. Then your type of lifestyle, the type of food you eat, and all of those play an important role in you either developing or not developing this breast cancer disease. Now, what would be some of the signs and symptoms of someone who is developing a breast cancer disease? The first thing I always like to keep the simple things simple, is the first thing is, if you look at the skin of your breast, because our eyes are the first things that we always use, of course. So if you look at the skin of your breast, there may be a swelling. So swelling is one of the signs and symptoms that we'll have. There may or there may not be pain. Then you may discover a change in the skin. So just like an orange peel, your skin may begin to have those dimples on it. So they call it the orange peel skin. So you can realize that the skin around your breast is having that orange pale skin. Then looking at the nipple, you may realize that instead of the nipple being everted, that's protruding outward, it goes inward, what we call inverted. So if you try to press the nipple, you may find out that you can have either a bloody discharge or a purulent or a pussy discharge. Also, you may realize that you may touch it and you will feel, if you try to touch, you can feel maybe lumps in it, or you may not feel lumps. It is swollen, you can feel lumps, you can see a change in the color of the skin, there may be a nipple discharge, there may be or there may not be pain. So those are some of the signs and symptoms of breast cancer disease. Now, how do we prevent this breast cancer disease? We have looked at the risk factors, both the modifiable and the non-modifiable risk factors. How then do we prevent it? It's simple. Looking at the risk factors, for example, if we know that obesity increases my risk of developing breast cancer disease, then what you want to do is to maintain a healthy diet, to maintain a healthy weight. So how then do you do that? It is encouraged that you eat foods that have low carbohydrates, foods that are rich in nuts, foods that are rich in omega-3 fatty acids, healthy things that are going to bring your weight within normal ranges. Then we also looked at age. With age, there's actually nothing you can do about it, but then I'm going to teach you about the self-breast exam. Then we looked at alcoholism. So you want to cut down your level of alcohol consumption. If you are unable to actually quit alcohol, then you want to reduce your level of alcohol consumption. Then for some people too, we realize that their genes, their genetics, maybe your close relative, your immediate family, your mom, your sisters have had breast cancer, then you are at risk of having breast cancer too. So in things like, for situations like that, you want to go for regular checks, regular mammograms, to make sure that you don't have these genes in you. And then I forgot to mention one other risk factor is for people who have had breast cancer in one breast before. There is a likelihood that you may have breast cancer in the other breast. But like I said, because you have one or two risk factors does not mean that you're definitely going to have breast cancer. And because you do not find yourself having any of these risk factors does not mean that you may not have breast cancer. Just being a female is already a risk factor. Okay, so now how then are we going to do these self-breast exams? No doubt, doing regular mammograms are very effective. But how many of us can actually afford to do these regular mammograms? Simple things, if you can do these breast exams fast enough or on time, you may be able to identify some of these signs and symptoms before they get to a later stage, and then treatment may commence, which can actually increase your prognosis. So I'm just going to show you guys how to do this self-breast exam. The first things first, you stand before your mirror as a lady 1 week after your period. So you stand before the mirror. Why do we say 1 week? So that's enough time for all the breast inflammation to have decreased, so you can better appreciate the exams you're about to do. So what do you do then? You stand before your mirror, you put your 2 hands at the back of your head. Of course, you're going to take off your clothes when you're doing this, so you can have a better view of the breast that you want to examine. So you put your hands behind your head with your clothes off. You start by inspecting the breast. You look at it through the mirror. Are the nipples together? Are the nipples all aligned? Are they in the same are they at the same level? So you examine the nipple, you look at it. Then you look at the size. You want to examine the size of the breast. It's true that no two breasts are the same. Actually, our body parts, one is slightly larger than the other, but the difference is not usually so much. So you don't need to worry so much about that. Now, when you look at it and you want to examine, after examining the skin around your breast so well, you want to examine the right breast. So you're going to use the left hand to examine the right breast. And if you want to examine the left breast, you're going to use the right hand to examine the left breast, okay? Okay, so now this is it. You put your hand, you examine the skin around the breast. You look at the level at which the breast is. Are they symmetrical? Are they of the same sizes? Is the skin okay with your other skin parts? Are the colors okay? Then you use this hand. Now you're going to divide your breast into 4. For people who have smaller breast sizes, it's easier for them to do the test, but it's not stopping those who have more breast mass than others. All you need to do is to be able to massage it and go right down so that you can feel exactly what is happening right there. So you divide your breast into 4 parts. You begin from the lower outer part. You massage in a circular motion. You move to the upper outer, that's towards your armpit. You move to the upper outer part, you massage. You move to the inner outer part, you massage, that's 3. You move to the upper inner, that's 4. And then the 5th one, you go to the nipple, you massage the nipple, that's 5. Number 6, you try to press the nipple to find out if there's any discharge. It could be blood, or it could be pus or any other offensive fluid. So you try to press the nipple, that's the 6th. And the last stage, you are going to massage the axillary region, which is immediately what you call your armpit. So you're going to massage there for any swellings or any lymph nodes. So I'm going to repeat the steps again. First steps, you put your hand behind your head, you examine the skin, you inspect everything around your breast. The second thing you want to do is you use the opposite hand to massage the opposite breast. So you divide your breast into 4 parts. Then you start from the outer lower part of your breast. You massage, step 1. Step 2, the outer upper. Step 3, the inner lower. Step 4, the inner upper part. Step 5, you massage the nipple, which is the middle part. Step 6, you actually press the nipple, you squeeze the nipple to find out if there's any discharge. And the last step, which is step 7, you're going to massage the armpit. So with that breast exam, we hope that you're going to practice it. It takes you nothing more than 2 minutes to do that self breast exam. So you repeat that procedure on the other breast still. If you notice any abnormalities, any changes, you feel like there is a lump, you feel like there's any discharge, there is a swelling, there is pain, don't hesitate to seek your medical doctor. You should go so that they can check it. You can get a second opinion so that your breast can be properly examined, and if there's anything, they'll put you on treatment. So guys, thank you so much. I hope you've learned something, and don't forget to like, to share, and to comment. We enjoy listening to you in the comment section. For those of you who have not yet subscribed, please do so, and for those of you who have already done so, thank you so much. We are grateful. I remain your favorite host, Nurse Ika. Bye bye.